Hey everyone, Jason from BodyWorx Physio here today with my physio Kel. We are going to get in and show you how we would look at treating some hamstring problems, and in particular I'm going to be doing some dry needling on the hamstring. So dry needling is great. We find it's a really useful tool as a physiotherapist to get some quicker results, especially with some of these tough muscular injuries. So from a physiotherapy perspective, the needling works by increasing blood flow through the area that we needle. It makes the muscle contract maximally around the needle when we stimulate it and we feel the muscle twitch, and then it relaxes out afterwards. And it also stimulates the immune system in that area. There's also some theories about pain gating and affecting the way that you feel pain in that area. But from my perspective, the main things we work on are those first three. So increased blood flow, decreased muscle tension, and influx of immune response in that area. So what we're going to do with Kel's hamstring, she's had some problems with her running with some hamstring tightness and injuries. So we're going to look at needling down through the central portion of the hamstring and then the outsides as well. Whenever we do needling on an area, we always want to make sure that the area is nice and clean and that our hands are clean. So we're going to sterilize with aqueum or clean with aqueum. In the clinic for a general patient, that we call it a clean procedure, in that our hands and the body area is clean, it's not sterile. So unlike when you have a surgery done, that is a sterilized procedure and it has to be because we're opening up the body. In this case, it's just a clean procedure. I would note that we generally don't recommend that you ever have dry needling as an immune compromised patient. So anybody that has immune compromise, so chemotherapy, end-stage AIDS, anything where your immune system is not able to cope with general everyday challenges, it's not something we recommend. You can theoretically do it as a sterilized procedure, but it's not something that we at BodyWorx would feel confident doing in our clinics, and we want to make sure that we protect you and give you the best care. So we do it as what we call a clean procedure. So we're going to open these needles up. So when we pop a needle into an area, normally there's not so much pain. It's just a very tiny little prick, sort of like a bindi. So we just tap it in through the guide tube, and then I'm going to slowly advance this in. Now, depending on the area we're treating, we're going to go to different depths. So because Kel's got quite a nice muscular hamstring, I'm using a slightly longer needle than we would use in other areas. And she's doing really well not to jump around, because I could feel the muscle twitching in there as I was doing this. We're going to go down a little bit lower, and I'm just going to feel for any muscle tightness that we want to chase. And so we just slide that gently into that area. And you can see the little muscle twitch she got there as we look around. Ooh. Now, occasionally when we needle, we do stimulate a little sweat gland. So we can't see sweat glands under the skin. Kelly's jumping and laughing a bit now. Oh. So occasionally we will hit a little sweat gland. It's really important to tell your physio if when they pop the needle in, if it stings and doesn't stop stinging. Because normally once these needles are in, it's normal to have a dull, achy sensation in that area, but you shouldn't continue to feel any sharp stinging. If you do, that's abnormal, and we want to remove that because it's most likely that we've stimulated a little nerve cell around a sweat gland. We can't see or feel it, but it won't stop stinging if we leave that needle in. Now I'm just going to, ooh, got a nice little twitch in there. So we're going into the medial hamstring, bordering on the groin. And then we're just gonna go for one down here through this lateral border. So I'm just gonna have a feel down till I feel a tension in the muscle. And go for that there. So what we would normally do, there's different styles of dry needling. We can do passive dry needling where we just pop the needle in and leave it. Active dry needling or trigger point dry needling where we target the trigger points with each needle, pop it out and put another one in a different area. I like to do a combination where we pop the needles in, leave them, stimulate them for a bit, so we can go back, give them another little twitch. Leave them for another minute or two and then come back and do it again. I find it's a nice combination because it's gentle, but it also gives really good results. So in this situation, as I said, what we're doing is we're targeting on the hamstring muscle in this area. So we do dry needling for blood flow, so extra blood flow or vasodilation, for relaxing the muscles, and in some cases such as chronic tendon injuries like in the knee or in the elbow or the shoulder, for stimulating that immune system in that area to sort of kickstart a response to get the body healing itself. So we're really utilising the body's own response to those needles. If you've got any hamstring or hip issues, or you'd like to give the dry needling a try, give us a call on 4952 7033 or duck on the website bodyworxphysio.com.au. Have a look at the information on there, and it's really super easy to book an appointment online if you want to come in and see one of our physios across Newcastle, the Hunter Valley or Nelson Bay. Thanks and have a great day.